Welcome to another Vegan Primary Care live session. Hello, this is Dr. Scott Harrington coming to you live from my doctor's office at veganprimarycare.com, where you can see a vegan doctor as your primary care doctor from the comfort of your own home from most US states. Even if you happen to live in Florida, then I'm also open for in-person visits on Fridays in Pinellas Park, which is just north of St. Petersburg. Come in to see me not just for a one-time consultation, but as your primary care doctor, someone who gets to know you and someone who can be your health advocate. Because I'm licensed in most US states, even if you move, you don't have to change doctors. If you are vegan, then get a doctor who gets you. If you haven't adopted a plant-based diet yet, you are still welcome to be my patient. But beware, a healthy vegan diet, exercise, and lifestyle changes will always be my first recommendation. My goal is to help you take control of your health, and through the power of a healthy lifestyle, we will work to heal your chronic conditions with the ultimate goal of helping you come off some of your chronic medications. For my patients who cut out animal products altogether, you will not only be helping yourself feel better, but you will also do your part to stop animal suffering and to decrease your impact on the environment. Remember that this content is for educational and entertainment purposes only. This video is not intended to take place of your own doctor's advice. Okay, we are streaming to multiple platforms. We've got YouTube, Facebook, Twitter, and Twitch. Ready to take your questions. All right. Let's see. Okay. We've got Rena. And we've got, all right. And we've got Vida Liberata. Okay, hello. Yes, I was gone for 2 weeks. And so I'm back, and I'm ready to answer your questions. Okay, we've got Kathy Tarr. Hello, Kathy. Good to see you. All right. Well, thanks for coming in, and let's hear the questions. Okay. All right. Is vitamin D from 20 minutes a day of morning sunshine still risky for skin cancer? No sunscreen is being used, and I am here in Florida. Okay, so yeah, Rena. So there's some pros and cons, and so 20 minutes in Florida is probably all you need. 15 to 30 minutes max for getting the daily vitamin D, about equivalent to 2,000 units of vitamin D, oral vitamin D. So that they should be equivalent. However, I do know that the sun causes sun damage to your skin, and you can see this. You can see this already taking place. If you look at your arm, if you look at the top of your arm, you'll see some speckles and some freckles, and it'll look a little, darker skin or, more aged looking. And then if you flip your arm over and then you look at the back side, the underside of your arm, it has had less radiation. And so to me, that shows just the sort of the effect of the sun on your skin, and something that you can see pretty clearly that, yes, the sun has an effect. And so, yes, there's a risk of skin cancer, but there's also the sort of the sun aging effects on the skin. So it's this balancing act. Now, there's also sort of the unknown. There may be some effects that we get from the sun that we are not really aware of, not sure about, that might be having additional effects that are probably, that may be important because that's how we evolved, to be getting sun on our skin all the time. And so I mean, there's even some sort of suggestion that the plants we eat are still being affected by the sun, even under our skin a little bit, potentially. So, but I don't know about evidence on that. So I don't use the sun as my primary source of vitamin D. I'm pretty fair skinned. I get burned really easily. And so I use vitamin D. I use in the winter months where I'm not getting much vitamin D, I'll do 5,000. And then during the summer months, I'll do about 2,000 international units per day. So that's what I recommend, Rena, and great question. Dr. Greger from nutritionfacts.org just put a great infographic to the equivalence of sunlight versus vitamin D based on your latitude where you live. And so if you see that, yeah, post it. It's a great infographic. One thing that you got to know is vitamin D needs to be taken with food, with a source of fat, some sort of fat. There's fat in most foods that we eat, but you get better absorption when it's accompanied by fat, not necessarily on an empty stomach. Your vitamin B12 for us vegans, because we're not getting vitamin B12, we need to take that on an empty stomach. So keep that by your toothbrush and take your 100 to 500 if you're under 50. And then if you're over 50, take 1,000 micrograms of B12 and keep it by your toothbrush. Okay. All right. Thank you, Rena. We've got a question from Vita Liberata. Would the blood pressure machines at the stores be trustworthy? I'm not able to put on my cuff properly due to a wrist injury. Okay. Well, Vita, yes, I recommend that people have their own blood pressure cuff. This is the age of telemedicine, and the home blood pressure cuffs work really well. I do recommend getting one for your arm because the wrist ones are a little bit less, or the accuracy is a little bit off at times, whereas most of the studies are done with the brachial cuff, the arm cuff. So I recommend the arm cuff ones. They are between $40 and $50. You can get very expensive. You can buy a $100, $120 Wi-Fi one. I don't think that's necessary. They have very, very cheap and very reliable arm blood pressure cuffs on Amazon. So if you've had injuries and the wrist cuff is all you can use, get the wrist cuff and you can maybe, if you go to see the doctor, check it and correlate it and see how it does. But for the most part, these devices are fairly accurate. And if you're getting it done over time, you can get a sense of what your blood pressure is doing. So great tool. I do ask my patients to go ahead and get a blood pressure cuff, especially if we're 100% telemedicine. That way, it's just like going to the doctor's office and you get your blood pressure done there. You will note that when you go to the doctor's office, many of the doctor's offices just use the automatic blood pressure cuffs, just like they do, just like you can do at home. So it's nothing necessarily special at the doctor's office. Many doctors and paramedics and nurses and stuff will have the ones they can do, and you listen to the pulse be diminished by the blood pressure cuff and test the blood pressure cuff manually. But it's so very easy to use these automatic ones, and they're very accurate. Okay. All right. Hope that helps, Vita. All right. Rena says, thank you. That is very helpful. I will stick to supplements. Okay. Kathy says the Wi-Fi ones do not connect easily and are not worth the money. Okay. Kathy brings up a good point. I have gotten into getting some different Wi-Fi, Bluetooth connected devices, and I'm constantly messing with the device, and then the connections don't go right, and I'm trying to troubleshoot, and you call them and they say, well, this is a problem with your Wi-Fi or something, and so I just find is just to have the ones that are not connected. They're cheaper, and I agree with Kathy 100%. So as that gets even a little bit more, as the prices come down, then maybe the only option would be to buy one with Wi-Fi. But Retro, let's silence the phone there. Sorry about that. Okay. Great point, Kathy. Great point. So we do have a special guest today. Straight from my tower garden. Special guest today, Swiss chard. I just had to bring this out because it's so crazy, right? This is really impressive. Swiss chard, once it gets started, they start off so small and they seem so feeble and they're just going to keel over and dry up or something. But once you get them started, man, they go like crazy. And so, yes, it is so fun to reap the benefits of growing your own greens, because if you buy the greens in the store, sometimes you buy them, by the time you get them, then they're kind of wilting and rotting and stuff. So having something growing on your porch or growing through a hydroponic system I love it. It is like my new hobby. And I was nudged by my sister because she got one of these hydroponic systems for me for my birthday. And thank you, Julie, my sister. She's really got me kickstarted on this. Okay, so we've got some new questions. They've come in here. Okay, for someone supplementing with calcium, is magnesium also recommended? So, I'm kind of, for Fernanda Thompson, I kind of poo-poo the idea of a bunch of different extra supplements. Now, that being said, calcium is very important. If you do one of those chronometer apps, one of those food logging apps, you'll realize that you oftentimes are short on calcium. We're not as commonly low in magnesium. People on keto diets and people, it's like all you hear about is magnesium, but they're not eating foods, greens and fruits and vegetables to the same rate that most vegans are, where they're getting plenty of magnesium. So, but calcium does tend to be a nutrient of concern because we tend to not get it as much as high as the recommendations are, 1,000 milligrams a day, and if you have osteoporosis, 1,200 milligrams a day. So if you do supplement, I don't recommend supplementing with big whopping doses of calcium. When the Nurses' Health Study was remined for the data about calcium, they found associations with clotting and heart attacks. So gone are the days where we recommend 1,000 milligrams of calcium twice a day, 2,000 for postmenopausal women with osteoporosis. Now, the new era, it's supplement just up to 1,200 with what you find from logging, doing a food log. Maybe you reach up to about 800 typically, then just do 400. Maybe cut it in half and do 400 twice a day. And don't worry about the magnesium. That's what I recommend, Fernanda. Okay, we've got Vita Liberata. Thank you. I'm at the blood pressure machine at the stores like Publix where they sit and put you in your arm and does your blood pressure reading. Are those also known to be accurate? Yes, they are. They are known to be accurate. You'll see less and less of those now with the concern with the pandemic and this kind of thing. So I honestly recommend people just get on Amazon and go ahead and get one. I can pull up real quickly. Blood pressure cuff, vital signs equipment. There is one that I recommended. I've been recommending for a while now, so the price may have changed a little bit. But for the automatic blood pressure cuff, the Lovia, Lovia blood pressure cuff was $29. $29. The Lazel blood pressure monitor, $46. It has the best, largest display, kind of pretty display. And Paramed blood pressure monitor, $29. So any of those I recommend through Amazon. Boom. Same day. It's almost too good to be true. It's amazing. Okay. Mandy Touchton Jackson. Any suggestions for natural sleep supplement for postmenopausal women? Okay, this is a great question, Mandy. Sleep aids, and I agree with you. Sleep aids, like things like Ambien and these trazodone and stuff like this. You want to try to avoid these types of medicines, especially the Ambien, and especially benzos like Xanax and Ativan and diazepam. These medicines are addictive, and you want to try to avoid it because you will sort of become, even if you take something that's not supposed to be addictive like melatonin, you can kind of become a little bit psychologically addicted. I'll never sleep without my melatonin. So, yes, if you're going to use a natural supplement, melatonin is probably the one you should use, but not chronically. I don't recommend using it chronically because you can kind of get tolerant to it a little bit and have to continue to up your dose. And so these are the best things to do. So light exercise in the daytime, not close to the sleep. Lights early in the morning and in the day are very important, and avoidance of lights. So the pineal gland that gets input from your eyes is a part of creating your own circadian rhythms. And we're constantly messing up our circadian rhythms with the blue light from our phones. And so what you have to do is create a ritual for sleep. You make it really, really dark, and you avoid blue lights, and maybe you take a bath or a shower, and you kind of weave your magic spell as you put yourself to sleep. And that's key. Let me go back. Specific recommendations for natural remedies. One of the things that you worry about postmenopausally is for hot flashes. And so I really have to hand it to Dr. Neil Barnard from the Physicians Committee for Responsible Medicine. He has done actual studies on soy for hot flashes. There's a post on my website about someone who went through this study. And what you do is you actually buy soybeans. Adult soybeans, they're kind of yellowy, drab color, and they have more isoflavones than like edamame and tofu and soy milk. So more isoflavones per serving. So half cup of these adult soy beans. You can go ahead and cook them up. You boil them up. You buy them on Amazon, and you cook them up, and you have them in your fridge. And then you add, ideally about a half a cup per day to your meals. And what this does is the isoflavones, the phytoestrogens, the plant-like estrogen molecules will help to reduce hot flashes, help reduce it just like you were taking an estrogen supplement. But you don't get the bad side effects. It's kind of the best of both worlds. It doesn't increase estrogen stimulation of the uterus, causing uterine bleeding, and it doesn't cause things like breast tenderness and that sort of thing. Or increase your risk for breast cancer. Countries that eat the most soy have lower rates of breast cancer. So definitely be having that soy invade your diet. Get that soy in there, and get it with those adult soybeans that you get the most isoflavones. There's also isoflavones in beans as well, other beans other than soy, but soy is the highest. Okay, that is what I recommend, Mandy. Okay, we've got a question from Melissa Dervais. I find that I get better results in my blood pressure cuff while lying down. The arm is near the heart and the body is relaxed. I realize the results can be a little less than when you're sitting, but it seems to work. Your thoughts on this? There might be a little bit less blood pressure while you're laying down. There's something that they do in like the ER, orthostatics. They'll sit you down and do blood pressure and sit you up and then stand you up and see if you have significant blood pressure changes. The big one is a heart rate too. If your heart rate, having palpitations. Some people will have something called POTS syndrome, postural orthostatic tachycardia syndrome, where if a lot of vegans will have really low blood pressure, and sometimes they'll feel palpitations a lot because of their pressure is really low, and maybe there's blood pooling in the legs, and then not enough blood is getting up to the heart, and so they'll have palpitations and stuff like this. You can actually do your own POTS test. If you buy a blood pressure cuff, that it also tells you your heart rate, and you do a test lying down, and then at 1 minute, 3 minutes, 5 minutes, and 10 minutes, and you see if the heart rate goes up by 30 points. That is a diagnosis within the 10-minute mark. Then you can get this diagnosis of POTS. Now, that being said, that can explain why you're having these palpitations. But simple tricks to reduce the palpitations from this is to squeeze your arms and squeeze your hands and squeeze your legs and kind of your leg muscles and your butt muscles. It will push the blood back into your core, and it can help to lower your heart rate. So for blood pressure, if you are having elevated blood pressures when you're getting tested, oftentimes there's this white coat syndrome. you're driving to the thing, you run into traffic, you're stressed, and you get there and they sit you down and take your blood pressure might be elevated. So yeah, you can, if you want to try to get more accurate result, you can maybe sit for 5 minutes in a relaxed state and check your blood pressure. So I think that you don't necessarily need to lay down every time you test it, because we walk around and we're upright mostly throughout the day. So I would check your blood pressure upright to get sort of more of your average state throughout the day. All right. Thank you, Melissa. Okay, how about this? Karen Bliss says, yes, greens, go greens. I love it. Okay, any experience or perspective on plant-based keto? All right, Jonathan GI. Well, I don't recommend keto diets, and so I don't have a lot of experience with it. I've never done a keto diet. Now I've done fasting, water fasting, where you go into ketosis, but I don't recommend eating high protein and high fat diets and avoiding the carbs to get into ketosis. And so in general, I don't recommend this. There has been, when you're eating a lot of fat, it's real easy to bust your ketosis, and then you're having a lot of fat, and you're come down from the ketotic state. And we do know that things like saturated fat cause diabetes, insulin resistance, and all this stuff. So I try to have people come off that focus of fat and kind of stay high carb, but super low fat. So kind of opposite of the keto diet. So, I mean, you will see studies that, show some benefits with keto, but I find that it's just easier to stay with the carbs because of compliance and not having to worry about being in a ketotic state. So, there are problems with ketosis and having low fiber intake and constipation and people having headaches and this kind of thing. So I avoid that. So I hope there are a lot of people though that venture into that. And so, but try things out, see how you do. But I recommend for my patients to avoid it. Okay. All right, so we've got Susan. Susan Graham, good morning. How long is it safe to take Miralax? On the bottle, it says do not use more than 7 days. I have constipation due to cardiac medication I take, and this isn't an issue for me that you normally deal with. Okay, Susan, constipation is like my favorite topic. Thank you for bringing it up. I'm sorry that you're dealing with it. Miralax is a very safe medication. An osmotic laxative. Osmotic laxatives has water will stay inside the lumen of the intestines, inside the intestines and the colon, and so you get additional water in the stool to help it be soft and this kind of thing. So it's not addictive and not habit forming, and so it is safe. So the number one thing I recommend if you're constipated, honestly, is an enema. Now that kind of sounds kind of aggressive and gross, but warm water enema, not hot, but not cold, so just lukewarm water enema can help you pass the driest part of the stool and help get things moving. There are, in terms of things like prunes have a little bit of sorbitol in them, and they also are high in fiber. And so the magic number is about 10 prunes. So it's definitely, 10 prunes. And that's a yummy. I love prunes. They taste delicious. You can even kind of soak them a little bit so that they're a little bit less hard to chew. And gosh, it's like nature's candy. So what a great benefit. You get help with the bowel movements and this. Miralax is one of my favorite medicines because it's non-addictive. You can put it in hot or cold liquids. It's safe, but one dose of Miralax is too gentle of a dose if you haven't had bowel movements in that long. So you're going to want to do probably 3 doses. Miralax is titratable. You can do 1, you can do 2, 3, or you could drink a gallon of it, and it's like a colonoscopy prep. So That's why I love it, because it's so it's titratable and it's gentle. It's not addictive. So coffee and stimulant laxatives like X-Lax and things like that can cause the bowels to kind of move. These are relatively addictive in that you can get sort of, my bowels won't move without a stimulant. So, but those are options too. Having a coffee, taking an enema, having a coffee, or X-Lax type of medication. And maybe I'm thinking of Dulcolax or other Bisacodyl or other stimulant laxatives, but coffee works just as well for that. All right. Hopefully that helps, Susan. Yeah, if you haven't had a bowel movement in that long, I would recommend starting with an enema to kind of get you started. Okay. Karen Bliss says, can you share your advice on hydration? There's so many different messages about how much and what counts besides water. Does it matter when you drink it? Should you spread it out evenly throughout the day? Okay. Great question, Karen. With this, I recommend, let your body be your guide. If you're eating a diet rich in whole foods, you're not going to be that thirsty, because a lot of times, unless you're eating, a lot of dry foods and nuts and these kind of things, you're going to get a significant amount of hydration simply from the foods that you eat. Especially if you're eating a lot of high water content fruits and vegetables, you think of like cucumber and peppers and fruit are so rich in water. And this is a great thing. This is really, if something makes you really thirsty after you eat it, it should send you a message that this probably wasn't good for me. I'm having to rehydrate it with extra water. So in the raw community will often use dehydrators to come up with crazy concoctions of amazing things like wraps and dehydrating foods and making them a little sweeter. And now I think these are amazing and can taste delicious. But one of the things that can happen if you eat a significant of your food out of these raw dehydrated type foods, you can feel really bloated because you eat to your full with the dehydrated food, and then it starts retaining fluid and sucking fluid in, and you can feel really bloated and have pain. And so believe me, I've been there. You'll see 6 cups of water, 8 glasses of water. I don't even pay attention to that. So just drink enough water to make your urine clear. And if you're eating a diet rich in whole foods that are high in water content, that's very easy. You may drink, 1 or 2 glasses of water a day. And, so I don't like to throw out the number there because I don't want my patients pounding water and feeling like they have to get that. I'm pretty minimal like that. I just recommend several glasses of water a day to manage your thirst. And if you're noticing that your urine is darkly colored, then that's a problem and you should be drinking. If you feel thirsty after you've eaten something, it was probably processed and devoid of water, and consider not eating that food in the future, honestly. Okay, good question though, Karen. Mandy says, thank you. Okay, Betsy Payne Touchton says, thoughts on CBD oil for sleeping. CBD oil. Well, with marijuana and CBD and THC and this kind of thing, it is kind of a minor sin, and especially things that are, non-euphoric like the CBD. I have kept a very sort of open mind about these types of substances because, if they were terribly harmful, I would be, worried about them. So as far as I know, if the CBD oil offers a little benefit as a sleep aid, then go ahead and try it. You could try it and use it. But just like with anything, I did mention that you can sort of have a psychological habit that you can form onto a substance. Getting to sleep is kind of like a ritual. There's not an on-off switch on our brain. So, making it cool in the room, getting, having the sheets clean, mirror clean and not sweaty when you get into bed, having a white noise source like a fan or a noisemaker, and, avoiding the phone an hour before. This is called sleep hygiene. These types of tips are important. because you have to, it's almost like you're having to put the little child inside your mind to sleep at night. And it helps to be a little tired with exercise. And if you've done all these things and you want to try additional supplements, a CBD oil treatment might be reasonable. And so if it works for you, I would try it. Okay. Betsy Payne Touchton says, is intermittent fasting healthy? Well, yes, certainly. I mean, you're not completely fasting. You're not avoiding food at all, all day long. You're just constricting, time restricted feeding. So yes, there's time restricted feeding where you take the amount of hours that you're fed and try to compress that per day, and the amount of hours that you're fasting, increase that. So it's time restricted feeding. And then so maybe intermittent fasting, maybe that means, well, on Saturday and Sunday, I don't eat any food, just drink water. So either way, if you do a short-term fast, less than 2 to 3 days, it's safe as long as you're drinking water. You have to be kind of careful if you have diabetes and that kind of thing, you're taking medicines. And so I wouldn't recommend it in that case unless you're medically supervised. But the body was made to fast in times of when we were, on the savannas, searching for food. So, and fasting has benefits. Fasting, your body has autophagy where it gets rid of the cells it doesn't need. And it kind of takes a tally of, this cell, we don't really need this, or this cell's kind of old. Boom, let's get rid of that one. So this autophagy is a healthy process. But when people do the time restricted feeding, and so they only eat within a certain window throughout the day, I do recommend kind of getting that a little bit earlier in the day, because if you're trying to lose weight, we do have more our body is more prone to store fat in the later, the evening hours. You want to give so try to have your biggest meal earlier in the day. And so there is the eat like a king, eat like a prince, and then eat like a pauper kind of theory. And it used to be sort of a word of wisdom from the ages. And now it is a proven scientific fact that the food that you eat in the morning is more likely to be burned than stored, and compared to calories at night. So, doing a time restricted feeding helps with overall calorie intake. It helps to decrease that, but also keeping your bigger meals earlier in the day is also helpful. Okay, we've got hi from Tamara, Sergi, and Mom, and Simone. Okay, how are you guys doing? We've got some support for prunes. All right, I love prunes. I love prunes too. Okay, we've got shout out from Shirley Narducci. All right. And then we've got Erica Appleseed saying Sunsweet Joir D Noir prunes are incredible. I love it. Okay. We've got Susan says, thank you for response. I'll be adding prunes to my list. All right. And Vita says, thank you again. So listen, thank you everybody for attending, and we'll wrap it up. Remember to stay vegan, and I will see you here next week. Take care.